Welcome back to Heights of Healing. Today's episode is going to be incredibly valuable to anyone who feels stuck in their relationships or mental health journey. We're going to take a deep dive into what it means to be stuck in that gray area, where you know something isn't quite right, but you're not sure how to move forward. We've all been there at some point, and it's not always easy to recognize when we're stuck or what steps to take next. To help us navigate this important conversation, I'm excited to welcome a very special guest who has dedicated his career to helping people just like you break from these challenges. Our guest today is Dr. Gregory Marcell, a licensed professional counselor with extensive experience working with youth, adolescents, and adults on issues like substance use, depression, anxiety, and relationship challenges. Greg's therapeutic approach combines person-centered and a cognitive behavior therapy to guide his clients towards healing and personal growth. He's also the founder of Levels philosophy, which helps individuals become better than they were yesterday. I'm so excited to have him on the show today. Greg, welcome to Heights of Healing.
It's a pleasure to be here today, Dr. Height.
Thank you. Thank you for coming.
As my friend, my mentor, I started out in the mental health field with you. So just to be on your platform, it's a pleasure.
Oh, thank you. Thank you. Very humble for that. So today we're just going to run through some questions and then you and I will dialogue, chop it up a little bit of how you and I have both experienced this mental health and the phenomenon of how to be sound counselors especially with people who are struggling in that gray area. So I'm going to ask you a question, okay?
Okay.
Tell us more about your person-centered and cognitive behavior therapy approach. Where is it from your standpoint?
So my standpoint, when I have someone come into my office, I really just want to focus on them as an individual. You know, this is the first time that we're meeting each other. I don't know nothing about you, you know nothing about me, right? So I want to know what your values are, what are your beliefs, what are your morals. Also just understanding like your background. So, you know, people come to therapy for many different reasons, but when it comes for a therapist to understand what approach to take towards that client that you're servicing, that background is very important. You know, a lot of times we talk about cultural differences, and even within the African American community, there's a lot of different cultures.
It is.
So sometimes people may think, oh, well, we all black, we could all, you know, approach this person in this type of way, but we're different type of African Americans, you know, and the same for other cultures. So that's for person-centered. So cognitive behavior therapy, everybody's thoughts help them identify what behaviors they're gonna engage in, right? So I think CBT is always a good therapy to utilize amongst other different therapeutic approaches in the counseling setting, because CBT is helping you with changing those beliefs, those negative beliefs that you may have, and making them more positive to help you with making better decisions.
Yeah. Let me ask you, do you find it difficult, you know, you spoke about, you know, the African-American culture and African-American background. Do you find it difficult for African-Americans to really utilize CBT? Do you feel like it's more of a push therapy on them?
Oh, that's a good question. I think that therapy in general is difficult because you're putting yourself in a vulnerable place to be honest. And I don't think that any of us walk around every day to be 100% honest with each other, right? So when we go into the therapeutic alliance with our therapist, we have to really go with purity and understanding that, hey, I may look crazy, I may sound crazy, you know, but this is what I need in order to become a better person. So I don't think that it's pushed on them. I just think that it's effective, but it's not the only thing to help an individual. So you do have to look into other therapeutic approaches. One therapeutic approach that I've recently, like in my earlier years, I wasn't using it, but now I kind of really love doing it, is narrative therapy. Because it's helping with telling a story of whatever it is that person is coming to therapy for. And I want to know the story so that I can help you get down to what that core issue may be so that we can work towards solutions.
That's an interesting point, because with narrative therapy, what it allows them to do is talk about where they are in their process of therapy or what their problems look like.
Yeah.
You empower them the ability to tell their story from where they are with your help and your guidance. And you know, what I've noticed is that when we in general are stuck in that area of I don't know, that area of I'm just oblivious to what's going on. Sometimes we use the therapeutic alliance to pull us out of being stuck, and using narrative therapy helps them tell their story from their point of view. It empowers them to be, okay, this is me, this is what's going on with me, and I can trust you, the therapist, to guide me that way. And so that also makes our job hard, because they want to tell us everything at one time. They just want to spill it out. Here it is. This is my problem. You go fix it. Yeah. And you have to kind of back them in and say, let's slow down. Let's piece these things together. And it's interesting because during that time, that's when CBT kind of comes into play, when we try to cookie cut it to where we need to be so we can slow it down in the pace of the therapeutic alliance.
Right. And I think so recently I just did EMDR training, right? Oh. So it was intense, 40 hours. We was in that all day, and I did it in Wisconsin. But one thing that I really like about EMDR is that it talks about, your present, your past, the earliest childhood memory that you can think of related to your negative cognition, as well as the possible future cognition, negative future cognition you may have, right? And then you work on those things individually, and then once you finish that path, then you go into the next issue that you may have. So somebody could start wherever they want to start at. They could start at their earliest childhood, or they could start at their present, or they could start at what they may be scared of in the future, to help them with changing that thought process and turning that negative belief into a positive belief. So when I have clients come into my office, I mean, I'm sure you too, they do tell you everything. And it's just like, hold up. We can't work on everything in this one session. This is 1 hour. Yeah. And a lot of times they want to go over, but that's another thing. So, but we can't work in everything in one session. So really having that client identify what is most important to you during this time that you want to work on first, and then we can revisit, and maybe we may address some of the issues that you may discuss as we work on this one issue. So it's important that we help gauge them through that therapeutic process.
Yeah. Do you find it hard when clients come in and they want you to fix the problem? Do you find it hard with their level of taking accountability for their own stuff? For instance, like, oh, no, that's his problem. That's not my problem. I'm here to this, and this. And they want their feelings validated instead of wanting a therapeutic change.
Yeah. I've definitely experienced that with some clients where they just felt like, hey, I know I'm not the issue. This person needs to get this together, X, Y, Z. And that's just a time to help them reflect. Like, okay, let's reflect now. Let's role play, or let's change the tables, and you are this individual and this individual is you. A lot of times I experience that in couples therapy, right? So, it's a lot of constant blaming or constant, negative thoughts from one individual, and the other person think they just doing everything right. Yeah. And what I've learned throughout some of my experiences with my clients is that one of the individuals in the relationship, they typically struggle with past trauma related to either family relationships or related to, their ex relationships that they may have, and they're bringing it on, but they're not noticing that. So it's going back to gathering that history.
Yep. And interesting enough, that's where you see people in the area of being stuck, because they're not of the cognitive mind to know that this childhood trauma is causing me to have issues in this current relationship. Right. And because I don't know that childhood trauma actually existed to push me forward into these relationships, and the reason why I'm struggling in these relationships, that's that area of being oblivious to what's actually going on, and for them trying to find a way or a reason behind why are you like this. Interesting. What I like to do with couples when they come in, I like to use the couch therapy. Okay. So I have them sit on the couch, and depending upon how far they sit apart from each other, lets me know how much work I have to do. Right. because paying attention to body language is very important.
Yeah.
And what people tend to say out of their mouth versus what they present with their bodies is very important. And I try to pick up on that, especially with, not just with couples, but also with just individual clients that we come across. Like, tell me exactly what you're saying, because you're saying one thing with your mouth, but your body language is telling me another, especially when I challenge them. And I think challenging in therapy is kind of hard. What is your thoughts on that?
Challenging. So I love a good challenge. I think I carry myself as a straightforward person, and my clients learn that quickly about me. You know, and I tell them, like, look, you come to therapy and lie all you want. I'm gonna get paid regardless. If you want to pay me to lie and not, you know, work on the things that you really need to work on, hey, this is your process. You know, I'm just here to help guide you. I'm here to support you through this process. It's everybody has their different relationships with their clients, you know, so you have to build that therapeutic alliance with the individual and kind of get to know, you know, the things that they like and how they like to be addressed, and, you know, just how to talk to them to get them to understand some things. So sometimes it may not be cookie cutter and like, oh, okay, you go from A to B to C and then we're good. They may need you to go all around to understand, like, hey, this is a process that we need to take to help you with the issue that you're experiencing.
Yeah. What do you find most challenging as being a therapist in this day and age?
Woo. It's a lot of challenging things as a therapist. I mean, when it comes to family, they just think that you know you can solve all the problems. And I mean, a lot of them you probably can, but it's just like you don't want to, you know, because we're family. I'm not in that space to be your therapist or, you know, the family therapist.
Yeah, and then you want me to, I got to take the personal side of it. I
Right.
really know who you are. And you
Right.
want me to be a therapist. I can't do that. You know, that's not even ethical for me to do, but you got to understand that I know you. I've been knowing you all of my life. So I know what you
Right.
really got going on.
Yeah, so family definitely one. I think two, with therapy, a lot of people think that when they come to therapy, they're going to get fixed or they're going to get healed, or like, this therapist is going to help me solve this issue. And it's not a guarantee that when you come to therapy, you gonna be quote unquote cured, you know? So that can be a problem, because people may expect you to change them when they have to individually do the work to change.
Right.
You know, so I can tell you and I can guide you and I can support you all I want. But if you're not taking the steps and the actions that we implemented together, then you know, nothing's gonna happen.
That is the hard part. The hard part is them doing the work. You know, that's why sometimes when I formulate a session, you know, I tell them, you know, when you come into therapy, you know, we first come in, therapy is like an onion. You know, you come in with this first layer and you think that's the problem. But then the more we dive deeper into therapy and the more you pull back the layers of the onion, the more it becomes more potent, the more it becomes real, it sets in, and then that's where the tears starts to come. But a lot of people have some blocking when it comes to that approach. And they don't want to be put in an uncomfortable space. But what they got to understand is, as soon as you become a healthy uncomfortable in therapy, we're making progress. And you doing the work is very important. I always subscribe to homework. We only see you an hour out of the week. What's going on the rest of the week? You know, what's going on the rest of your day? So if you give me a glimpse as your therapist to tell me what's going on through journaling or doing homework or just recording yourself, then come back to me in therapy and let's work through what areas we feel like you have a deficit in.
I like that approach. The other thing too is that we as therapists, we have to find a balance. When we do give homework, sometimes people, I mean, it may be 6 days that go by and something can happen every day, right? But you're on this track of like, this is our target goal. This is what you came in to work on in therapy. And sometimes those other things that may happen that may not be in alliance to what their goal may be. And I think for therapists, we need to understand, like, that's okay that we may hop off of track, you know, because we could always go right back on track, because sometimes they do need that immediate, discussion and immediate time to just let out their emotions and feelings related to whatever has been going on.
Yep. And, I want to shift a little bit because I know that you specialize in children's therapy as well. And I know children can be kind of challenging, if you will, especially when you're working with the parents. And the parents tend to be stuck in their inability to properly parent their children.
Right.
And so we all know about generational curses. And so what tends to happen is the parent does not realize that what happened to them is in their childhood, that they are displacing that on to their child.
Right.
And then their child in turn mirroring the behaviors that the parent is exhibiting.
Right. Woo, that was a lot. No, but it's very it's a lot to compact with that question because working with children, I started out intensive in-home. Well, I started working with adults first and then moved into children. So intensive in-home and then outpatient therapy. But working with intensive in-home, I really love having that job because just seeing the different family dynamics and being inside the home and really being able to just work with everybody. It was a lot of work, but you could really see the change when the families were receptive. I think for parents who struggle with mental health issues or, behavioral health issues, I think it's important that, one, they have some support. And it's hard to say have some support because some people may not have no family and they may not have any friends, et cetera, but there are resources out there in every community, right? So identifying what can that support be, whether you're gonna join a church or you found a club, you went online and you're a part of some support group where you could go and just talk about whatever your issues are. Just find something that's going to work for you, just one thing, so that you can get assistance, one, with resources, but also that could be a layout so that you're not laying that out on your kids, right? They're not seeing you struggle with anger and they're not seeing you struggle with depression and anxiety. I also think it's important in the household that we discuss what depression, anxiety, and anger is, because those are all normal emotions and feelings and disorders that people have, right? So if me as a parent, if I struggle with depression and I have children, I want my children to know what depression is. I want my children to know the signs and the symptoms that I may experience, with depression, because everybody experiences different symptoms, right? And then that way that when they see me in that space, now they may know how to support me. They may know, okay, dad is feeling like this, let me contact grandma, or whatever the case may be. And we're not having those type of conversations. The same way that we're in therapy and we create safety plans, you don't have to have a issue to go to therapy to create a safety plan,
Absolutely.
So in your households, create safety plans with your family. Like, hey, if this happened or if I experience this type of emotion and feeling and I'm just out of it, this is my safety plan. So safety plans are really important. So, when we do safety plans with clients, we identify, what may be their triggers, right? So if a client struggles with aggression, all right, I want to know what triggers you to become angry, right? So they may say, I don't like loud noises, or I don't like social settings, or I hate when my mother screams at me, etc. So now I identify these triggers. Now I want to work with you to identify how can I help you with not experience anger and develop some coping skills, right? So, all right, loud noises are happening. What do you think you can do in that situation? Right? Because you can't control the loud noises. We know we can't control that. So let's brainstorm on what you think you can do. And as a therapist, we don't want to give the client the answer, but we do want to engage them to the point where they can start thinking about it and they can start coming up with some answers. And we could give a recommendation, and try to help them if they seem stuck. But once we identify those triggers and we create what those coping skills are that's going to help us alleviate from becoming aggressive or experiencing anger, then we want to also identify who's somebody that can calm me down. What's my support look like in this situation? So I'm angry right now, but when my grandmother calls me, she's able to calm me down, right? So I'm in the house. My brother pissed me off. I'm screaming, I'm yelling, I'm angry. Mom may not be able to calm me down because whatever the alliance is within that family right now, but grandma can. So let's utilize our strength in our family household.
Absolutely.
So that we can go ahead and alleviate some of the behaviors and negative emotions that the household is experiencing.
Yeah.
Because like you said earlier, like a lot of parents, they go through trauma, right? And their trauma, they put that onto their kids. And a lot of times it's just learned behavior. It's not that they're meaning to put it onto their kids. It's just that they didn't have the guidance or support to help them with learning how to be a better parent.
Right.
So like for a parent like that, I spoke about EMDR earlier, so eye movement desensitization reprocessing.
Okay.
Right?
Oh, that's long.
Yeah, it's long, and I always be like, but but yeah, that is a trauma-based therapy, and they say you can you can do it on children, you could do it on adults, but they said that if you're a mother that struggles with some type of traumatic experience that you have not dealt with, and you're pregnant, you can start doing EMDR while you're pregnant because that will help your baby. You know, because a lot of times the mother holds on all these feelings and all these emotions, and they're feeding that baby that energy.
Yeah.
So it may not show up when that baby is between 1 and 5, but now the baby is 10 and they acting how you was acting 10 years ago, but you're not correlating that. So, you know, it's important that as we get into relationships, whether you get married and you get living in a household, or you're a mother, you becoming and you get pregnant, or you just have kids and have trauma, it's important that y'all go through that trauma release experience. And EMDR is just one effective way that they can do that. So all therapists can't do EMDR. You have to be certified. And when you go through that certification process, then you have to go through 10 hours of consultation for a year. And pretty much there's different methods and techniques. So they utilize tapping like this. You can tap on your legs. They have machines that you can use that vibrate, lighting machines. And the goal of the therapy is to help your brain reprocess your traumatic experience and reprocess your negative cognitions and making them more positive. So it's not eliminating the experience that you went through, but now when you think about that negative experience, that traumatic experience, it doesn't harm you. It doesn't make you feel any negative emotion anymore. You know, so it's a very cool technique. I mean, when I looked at it, I was like, I don't understand how this is working because it's so simple. It's so simple, but yet so effective.
Yeah. I think that tends to happen in therapy. You get convoluted with so much and get bogged down with so many different therapeutic styles and techniques that sometimes you kind of confuse, the client that you're working with. Sometimes being simple is more effective.
Yeah.
And I do know that EMDR is very effective with people who abuse substances as well.
Yeah.
As you and I both have, traveled in those waters of substance use, and people who suffer with substance use disorders. A lot of them are people who have had trauma in their lives. And from my knowledge, EMDR helps with both the traumatic side as well as the behavior side of the substance use.
Yes.
With those people who have those disorders.
Yes, it does. Yes, it does.
And EMDR is something tangible that a client can use and they can see. Sometimes when people come into therapy, they think it's just talk.
Right.
And so what can you do just talking to me? But if you provide me with a therapeutic exercise, such as things that EMDR provides, such as the tapping and the sensitization from the things that you described, that helps them. Another thing that I like to use when it comes to anxiety, if you will. We know that, trauma is a part of the anxiety umbrella, and people who struggle with generalized anxiety, if you will. Generalized anxiety is when you consistently fearful or worry about just everyday life.
Right.
How am I going to pay my bills? How am I going to take care of my children? How am I going to get forth to work? Am I going to get sick because I go out in the rain?
Yeah.
And so it's called a thought stop technique.
Yep.
That's very effective. Actually, I've used it for myself. And, basically that is when you think about, you have something negative pop into your mind, right? Yeah. And then you say out loud, which sounds crazy, stop. But it triggers your brain to, why am I saying stop? I'm saying stop. But then it allows you to know, oh, I must be having a negative thought. And as soon as your brain realizes that you're having that negative thought, then you insert a positive thought, a positive feeling, or go to a positive place to help mitigate that negative feeling. Yeah. And over time, once you continue to do that, it's like rote memory. It becomes a cycle of, okay, I'm having something negative, now I need to replace that with something positive. And the thought stop technique has been very effective with people with substance use and traumatic experiences. Mm-hmm. Yeah.
I think another technique that I do like, a grounding technique, is the 5, 4, 3, 2, 1.
Oh yeah.
Especially when you're in a place that's like scenic, like around here, it's a lot of trees, it's woods, it's scenic. So when you think of, 5 things that you see and 4 things that you smell and 3 things that you hear, etc., it allows you time to really just be in tune into the space that you're in, right? And to notice your surrounding and to notice your breathing, and really just take some time to take that anxiety from here and just bring it on down to get to a neutral space and move on. So, a lot of people struggle with anxiety.
Oh yes, yeah. That's like the number one disorder.
It's very common. So, and I think that what's good is that I know for me, before, I've been in the field now since 2014, so 10 years. Shout out to me.
Shout out to Gregory.
So 10 years, and I know prior to me being in the field, I didn't know about anxiety or depression. Like, I know about depression, but I feel like a lot of signs and symptoms, I didn't understand. Like, I didn't know what it would look like if somebody was depressed. So now with depression, I know, like, okay, if this person that's typically super outgoing and, typically talk to multiple people and social, they're isolating, it may be something that's going on. They may not be depressed, but okay, you've been isolated, and let me look further into that. They may be engaging into crying spells, don't know why they're crying, can't explain it. The activities that they once used to like, they may no longer do it anymore, and there may be no reason why. And they may say things, words that may have me think like, oh, you feel hopeless or worthless in whatever your situation may be. Or they may utilize those exact words. I feel hopeless, I feel worthless, I feel sad, I feel depressed. And somebody that is experiencing that, that's somebody that I would want to, dive in a little bit deeper to see, like, hey, are you struggling with any type of form of depression? Because with all disorders, there's a severity level. So not every person with depression is going to be super severe to where they may be hospitalized because they have suicidal ideations.
Right.
They just may just cry and feel depressed every day, and it's been happening for over 2 weeks.
Yeah.
And they're at a mild depressive level, but there's things that we could do to get them out of it a little bit faster. So there are self-tools that people can use online, like the Beck Depression. You can Google the Beck Depression. You can go on Google and pretty much complete it. It's a 5-minute thing, and it'll let you know what your depression scores are.
Yep.
But you have to be honest.
Yeah, exactly.
You have to be honest with yourself.
Yeah, exactly. And the thing is, a lot of people, the misconception about depression is that they have it looking one way. Yeah. Oh, I'm self-loathing if, like Eeyore on Winnie the Pooh, or I'm down and I'm crying. And I'm always saying, I just want to talk about killing myself, right. Or, having those suicidal thoughts. And what people don't honestly realize is that people can hide their depression very well. Meaning they could come to work, smile, cheerful, joyful, and, be in the light of the party,
right.
And go home, and then that's where the darkness is, and that's where the crying spells is, and that's where the depression, and they lay on the couch, and they don't want to engage with people, and they put on a facade, if you will, to mask their depression, because with depression, a lot of people become shameful with
Right.
it, or it's not something that's culturally acceptable, depending upon the ethnic background. And so they tend to hide it. And so as family members, it may be surprising to know that one of your family members was diagnosed with clinical depression because they present it a certain way. And I think it's important for family members to try to look at stuff like that, because I'm one way at work or I'm one way with my friends, but how are you at home? It's important to pick up on, different types of triggers, different type of nuances of their behavior change, or did something happen? And especially when traumatic things happen in a person's life, in a family member's life, check in on them. How did this affect you?
Yeah.
How are you feeling today? Do you need some help? You want to talk about it? It's very important to do check-ins and not just think that everyone is mentally healthy in that space.
And don't try to diagnose somebody. Like, you not a
bipolar
clinician,
throws
not in
around
your
a lot.
office. Don't try to diagnose them, because a lot of times you will be concerned about somebody, right? And then you think like, oh, okay, I see this sign. Like, this person got to be depressed. So now I'm labeling you as depressed, but that may not be it.
Right.
I just may just have a bad day today.
Yep.
But you labeled me, and now you're treating me differently, and you haven't even allowed me the space to, express how I really do feel, so that you can understand. So a lot of times people do label their family members or close friends, and it's important that you do not do that.
Yep. I want to go back to your company. I want to go back to Levels. Talk to me and tell me about the model that Levels have developed to help navigate their clients through their spaces of being stuck in their depression and anxiety. How does Levels fit into Dr. Gregory Marcell?
Right. So Levels started as a group project in school when I was in my master's program, and pretty much I kept it when I talked to you and I said, hey, Dr. Hyde, I want to open a company. He was like, okay, I can help you. So I was like, all right, cool. So Levels, it stands for Leading, Elevating, Valuing Everyone, Launching Success. And I started out with intensive in-home, something that was very familiar to me. I've been doing it for a few years. I actually was a program manager at Dr. Hyde's office, Supportive Intervention Services. And, I worked a couple of different positions there.
You're very versatile.
So I learned a lot under Dr. Hyde's leadership. But, creating Levels, I've worked at other companies too, but being able to work at multiple companies and just see different leadership styles and just see different processes that companies do, and just knowing like, hey, I ain't really like this, or, oh, I really like this. This is something I may want to adapt. When I developed Levels, I thought about all of that. That was a part of my planning. I understood that it was important to create a wraparound services. So I started out with working with children, but do I just want to continue just working with children when I know that the families need help too?
Right.
So I want to add adult services. So that's what I did. I added, different services that were needed. And pretty much now I have created a wraparound service within my own company so that we can work with individuals longer, so that we can really follow the progress that they're having.
Right. Wraparound is very important, especially when you're dealing with people who are dual diagnosed. And what I mean by dual diagnosis, if they have a mental health and a substance use, disorder happen simultaneously. And what people, tend to not realize that I may be depressed because I abuse alcohol. Right. And we know that alcoholism and depression generally can be comorbid with each other. So in my question to you, tell me what tools or what therapeutic techniques and practices is Levels go to when you're working with these types of population, whether it's children, adults, substance use, anxiety, depression. What is it that feels good for Levels?
So when you say tools, I mean, as far as therapeutic approaches, everybody, even if you're not a therapist, some people are qualified mental health professionals, so they can't do the same thing that therapists do. But the state of Virginia is person-centered, right? So we adapt that within our practice because we want to work on the things that the client wants to work on, right? But the other thing with Levels, one thing that we're really good at is collaboration. So internal collaboration, but as well as external collaboration. The day-to-day process is very fast. we both have crisis services where there's people that's homeless, experiencing behavioral health issues, where they may be suicidal, homicidal at the time, have intense aggression, have hallucinations, delusions, and we have to immediately go out there and try to help de-escalate their symptoms. And we're servicing for acute time, 2 or 3 days, and we got to do all of this. So collaboration is the biggest key that I preach within Levels, and really just externally too, because we can't do everything alone. Levels is this much out of all of this that's out here in Virginia, in the Tri-Cities areas of where we work at. So helping people understand how to problem solve, helping the clients with creating a support network, because a lot of them come in with no support network. But yes, we're going to be a support, but also the individuals that the other clients that you're alongside with, as y'all all working together, let's create a healthy system to where y'all can be each other's support too, and also encourage each other. So I do transitional recovery housing, and all the individuals in my home that go to substance abuse groups at Levels, they've created like a brother and sisterhood, so now this person got a job, it motivated everybody else to get a job. This person is eventually finding his or her apartment, is motivating everybody else to move forward and find their own individual things that they've been wishing for in life. I've been working with clients in the transitional field for the past 2 years. We're doing transitional housing, and this year, a few of my clients, this has been the first time that they ever had an apartment. They 50, 60 years old. Yeah. They have jobs. It's like a whole new life that they're starting over. And that's what I want to see come out of Levels and everything else that I do.
Right.
So.
Right. Well, that's good. So what it sounds like is community integration, resources, family support, and the client being able to see the finish line.
Right.
To be able to move that goalpost. I think it's important, especially, when clients feel like that they're stuck and they have nowhere to go. And then they do take 2 feet forward, at least giving them some type of therapeutic praise. Like, see, you were able to do it. Right. You were able to move and get from, point A to point B. And what's sad is that a lot of people don't have that support. A lot of people don't have those community resources that's out there, or some people are just not knowledgeable, what resources are out there to help them. And I think that's where companies like yourself and Levels step in to have that community integration and, be that sounding board for those people who are really struggling. So, that's very powerful to be in a position in the community to offer that. A lot of people feel that mental health is just a therapist and a chair. Right. And maybe a book and some writing utensils, and then the problem is solved. And where therapy goes more than that, it's much broader than that, because it may start with the therapist in the chair, but that may not be where it ends. It could end with a psychiatrist, because you may need medicine, because you can't you have all of the tools to effectively help you with depression, because we know that depression messes with your serotonin level and your dopamine, And so when you have a sluggish serotonin level, sometimes you need that SSRI, which is a serotonin medication that helps with bringing your serotonin levels up to where you need to be able to function. And then the tools of therapy will help. And then the tools from family support can help, and community integration. Yeah. So it's a lot of ways to get to where you need to be therapeutically sound, but it's a lack of knowledge that, we tend to see when that people may be lacking. Yeah. It's
important that we build the external community outside of our internal community to make sure that the therapeutic process is really working, and that we're really helping people change their lives. Yep.
As being a pioneer here in the mental health field, and you being a doctor, and you've been doing this for 10 years, what are some key messages that you want people to take away when they listen to you, or they hear you, or even when they come and sit on your couch and get advice from you? What is it that you want them to walk away with?
I want them to walk away ultimately with confidence at the end of the day. Confident in every decision you make, whether it was the right decision or the wrong decision, because there's still room for improvement and there's still a learning curve. You know, whether it was right or wrong, you still can learn from any situation. But I also want people to know that there are people out here that will support you. You know, there are people out here that will listen to you. You just need to be open to it. You know, and when nobody's rushing you to be open, when you're ready, you know, just know that there's spaces for you.
Yeah.
You know, because I think that sometimes people think that there's no space out here for me. You know, like there's nobody that's like me. There's nobody that's going through this situation. There's nobody that's going to understand.
Yes.
You know, and there is.
Yes.
There's a lot of people that go through similar issues.
Yes.
You know.
And, you know, some of the things that I tend to ask my client is, are you alone or do you feel lonely? You know,
Yeah.
are you alone or are you lonely? Because those are two different things.
Right.
You know, and they be confused when I ask them that question. Well, you know, Dr. Height, what do you mean? I say, well, do you feel like you're this only person that's suffering with this only thing, but you are surrounded by other people? Or do you feel lonely, like I don't have anyone and I don't have any support?
Right.
Those are two different things. And I think the phenomenon is identifying if you are actually alone or if you're actually lonely or you're actually both. That could really help with your plight to stabilize yourself, stabilize your mental health disorders, and get your voice back. You know, so
Right.
many people's voices are stolen from them, from things that has happened in life that can set into depression. And so, you know, the difference between being alone and lonely is a fine line.
Right. Yeah. And this is your manuscript. Like, this is your story that
Yeah.
you're writing. Nobody owns this. You own a publishing to it and everything. So you if you at any point in life felt like, hey, I didn't have any control over something, this is your moment to control.
Yep, absolutely, absolutely. But you got people who really don't want to give up that control or don't know how to give up that control, because the control is the only thing I have that's mine.
Yeah.
You know, that's the only thing that I can maneuver through life with. You can't take that from me.
Yeah.
So everything I can do to control right here is what I'm gonna do. However, that could be a negative reaction to what you're going through, and it can get you stuck in where you are when you're trying to move forward.
Yeah.
Yep. Dr. Marcell, thank you so much for taking the time out to come in and sit down and have a conversation with me. You know, thank you for all of the tools and tidbits that you have for the people that are watching. I hope that we do this again. Thank you so
Yes.
much.
Thank you for having me, Dr. Height.
Yeah.
And for those who are reviewing, if you want to look for me, Levels, I'm at Levels, so make sure you come see me. Levels, it stands for leading, elevating, valuing everyone, launching success. And thank you again.
Thank you.